Well, I mean, that's why I'm kind of glad that, entering this age of data, that insurance companies have, I mean, not all insurance companies, but the big ones have started moving towards that prevention. I mean, when I was working there, one of my things was to do technical assistance for, all their apps and stuff, because, a lot of employers now are putting together incentive programs so that different folks who decide to do, health
Yep.
coaching over the phone, engage with these Fitbit apps, it tracks it, sends it to the insurance company, they report it to your employer, then your employer gives you, bonus or, a discounted premiums, whatever the case may be.
Yep.
But let me ask you, just kind of looking at that, if these employers are going to invest into long-term plans and they're going to be utilizing this biometric data that people are, having on a daily basis. I mean, even there's this app called Happify that you just log in a few times throughout the day and report like what you're feeling from like a wellness
Hmm.
perspective. If we were able to utilize that data and get that to providers, I mean, do you think that would be a viable, maybe not solution, but a viable way to start educating doctors on what questions are right to ask?
Yeah, that's a really great idea. And we'd have to find out. So we've done some work where we've given patients like questionnaires before they see the doctor that are supposed to elicit contextual factors that might be really important, right? So we thought,
Okay.
oh, we'll save the doctor some time, we'll collect this stuff in advance, and it'll be in the medical record when they get there. We're doing
Yeah.
a study right now where we're studying that, and it like pops up as an alert if certain things are going on. One of the things in the early work like that we were doing that we found quite consistently is if the patient tells the doctor, I've lost my job and I don't have insurance, it turns out that the doctor paid less attention to that. They pay some attention to that, but they pay less attention to that than if the doctor at one point asks the patient, how is your insurance? And then the patient says, oh, I've lost my job, I don't have insurance. That is, there's something about actively asking the question, probing,
Yeah.
that helps the doctor pay more attention to it. And I don't think that's just doctors. I think that's a general human phenomenon.
Yeah.
We've also seen it when we looked at, there's this company called Accolade that just went public that gives everybody their own like personal health assistant. And you call your health assistant and they help like coordinate all of your care. They work for your company or your insurance company usually, but their job is to be your person and coordinate your stuff. And those folks are really good at contextualizing. We studied them. They did a really good job. But even they have the same kind of phenomenon. If they ask about it and get the answer, they pay more attention to it than if they're just given the answer.
Yeah.
So it's tricky.
Well, I mean,
Psychology is tricky.
Well, I feel that just comes along with active listening, right? You got to be able to
Mm-hmm.
know, how to probe for certain things. I mean, just having a good conversation, you got to ask those probing questions and kind of, shift the conversation in the direction you want it to go. But
Yeah.
I mean, I don't know. Do you think they would be beneficial? You talk about these health assistants. I mean, if different, doctors' offices, clinics had social workers there to be able to assist with folks that might be dealing with, other factors in their lives outside their physical health. Because I know that like a lot of like, county ran clinics have that, but, a lot of major hospitals
Mm-hmm.
don't.
I think there's no question that would help. One of the things that doctors do say, when you get them to talk about like why they don't want to ask these questions, is they feel bad doing it because they don't know what they would do with the answer. Like if I asked you and you said you didn't have access to transportation or you didn't have food, I would be stuck. I wouldn't know what I was supposed to do for you. And doctors don't like to feel helpless any more than any of us do.
Yeah.
So making sure that they know, okay, if you identify these kinds of problems, there's a resource available to you. And it might be you could give them to the social worker who works with you, or it might be you have a big database of resources, or whatever. But just that you feel like this is actionable information, not just information.
Yeah. Man, it is so sad. That because I mean, I don't know. I mean, from a standpoint that the providers, when you're in such a high stress job that you don't want to kind of have to deal with that additional emotional distress. I mean, I can completely empathize with that, but at the same time, it's sad that that's one of the main reasons why. Because you'd think that there would be a plethora of resources available to assist folks, but I mean, I guess that just goes along with the lack of funding that we've had for public health care, and I mean just public social services and resources in general.
Yeah, no, and there's a lot of, now there's a lot of interest, a lot of foundations and a lot of researchers are interested in exactly this problem. How do we align medical care with other kinds of social services that people need? They might need legal help, they might need childcare, they might need access to things. How do we make everything work so that they can stay not only healthy, but like productive and happy and all of these other things that we want for ourselves and for each other?
Well, I mean, I don't know. I feel like in this country, the financial stress is a big one because I mean, I feel like a lot of folks they don't even bother going for preventative appointments and physicals and things like that because they're afraid of what the answer could be. Very similar to what we are talking about with the doctors, right? I mean, that
Yeah,
kind of willful ignorance that if you don't address the problem, it doesn't exist because they wouldn't be able to afford what let's say a $300 imaging bill that goes straight to your deductible. I mean, I know a lot of
right.
folks can't even afford their $2,000 $3,000 deductible, let alone their out-of-pocket maximums.
Yeah, right. And I mean, and that's just medical insurance, right? Then we all also deal with dental things, and we all deal with like vision, and we know many people don't have insurance for those things at all. It's all out of pocket, and you find yourself in these terrible choices. Like, what am I going to spend my money on? I know, and if I find out something's wrong with me, I'll feel really bad about it. So maybe it's better not to know. And then, of course, that leads to like you never deal with it. It gets worse and worse, and by the time you have to deal with it, you're pulling out teeth or amputating limbs.
Yeah. Well, I mean, dental is a big one. A lot of folks don't realize how important dental health is. I had a buddy who, I mean, he probably never had dental insurance in his life. I mean, a lot of folks don't have dental, and
Hmm.
providers should do a better job providing that. But yeah, he had a tooth that rotted out, and he had ended up infecting his nervous system in his jaw, and that just spread. And now, he is having muscle spasms and stuff like that. And all of that was, that's
Hmm.
something that could have been easily prevented with, a couple of cleanings per year.
Yeah, tooth infections are bad. They're bad.
So I guess let me ask you. So when you're looking at kind of, ways that we can reform the system, I mean, do you think that there's things that can be done within the industry, or do you think it's better to go kind of and push more towards a public option and go that route?
I mean, I think it's a yes and. I think we have to do all of those things. I think when you compare the U.S. to countries that have universal single payer healthcare, whether it's government paid or whether it's through insurance companies, it varies how they do it. But I mean, those countries spend less money and get better health results for their population. So that would be a good thing to move towards. But we got to live where we are now, and where we are now, um, there's a lot that can be done. With doctors who want to help people. That's why they got into medicine,
Right.
to give them tools to make them better at doing that.
Yeah. So I don't know. I guess kind of looking at the tools that are available. I don't know what are some things doctors can do to try and increase their awareness of context. And I guess what sort of things should we as
Yep.
patients let them know?
Oh, so that's a great question. Those are both great questions. I mean, on the first one, right? So I'm, like you said, I work in the Department of Medical Education. So, we're really interested in how you train doctors. So there's some educational things in terms of having doctors, a lot of people don't know the way doctors are typically trained now. They get into medical school and they spend the first couple of years really just studying science and taking tests. And then they get thrown in to see patients. And they've learned all the science, but it's not clinically relevant right away. And there's sort of this big gap. And a lot of medical schools are trying to find ways to smooth that out a little bit. But right from the beginning, it's helpful for people who want to be physicians, who want to be healers, to be thinking about not just disease, but patients, people, right, that they're going to care for in their whole lives. So our medical school and many others have do that to some degree through the humanity, through missions in the liberal arts and sciences to think about what healing means, what disease means to people, right? Saul and I, of course, are interested in sensitizing people to, sensitizing physicians and training to context and how it can be important in healthcare, that it in many cases can be as important as understanding the biological mechanisms that are going on. And then once docs are in practice, they have to do certain kinds of like professional development on an ongoing basis to maintain their licenses. We've argued that a really good kind of professional development program is to use direct observation like we do with our actors, like is to use secret shoppers, or in some cases we've done actual patients with carrying hidden tape recorders, where someone analyzes what goes on in a bunch of visits and just holds a mirror up for the doctor to say, look, you saw all these patients, here's how often you asked about things that stuck out to us as things that were unusual. And here's how often when you did that, you got back an answer that changed your management of a patient. Don't you want to do that more? So that's what we do in the VA. We do that in 6 VA systems right now. And it has a big effect, that kind of audit and feedback.
Yeah.
There doesn't have to be a carrot or a stick, right? People want to get better. And if you show them, here's how you're performing and tell them, and you could improve in this way, they often will.
Yeah. It takes a mature mindset because, I don't know. I personally never like to get performance reviews. I don't think anybody does, but everything we always strive at to be better, physicians included. So I
Think of it
guess,
as coaching, not as a performance review, right? Think of it as
yeah.
you're playing baseball and you have a coach.
So I guess let me ask you then, once these doctors were confronted, right, with their shortcomings in certain areas, how quick were they to get those resolved? Did you guys have a program that was put in place, that kind of specialized, how these individual doctors could be better and what questions they should be asking?
Yeah, so in a lot of our work, we're doing multiple rounds of auditing, and we're giving them feedback over time. So when we're doing it in the VA system, we're using actual veterans who carry these hidden recorders, and then our research team analyzes them and anonymously feeds back data to the providers on every couple of months. So they can see, and we can show them charts. They can see sort of if they're improving, if they're not. And we give them specific examples of cases where they did really well, and cases where we heard things where we would have asked a question that they didn't, or we heard an answer that we think should have affected the care plan and didn't. Now we're not taking care of the patient; we're just listening to these visit recordings.
Mm-hmm.
But we've shown that when they do contextualize care, we've actually demonstrated by looking at the patient's charts 6 or 9 months later that the patients get better than when the care isn't contextualized, and the doctors pay attention to that.
So I guess going into the VA, when it came to the contextual errors, what were some of the big differences you've noticed between the VA system and some of the for-profit hospital systems out there?
Yeah, well, the big one, of course, is that patients are being taken care of at the VA usually don't have a financial issue with that, right? The VA is providing their care,
Right.
whereas in outside private practice, finances is often, as we've talked about, kind of a barrier. In the VA, the barriers tend to be more like some of those other ones that I talked about, competing responsibilities. Sometimes it's access, although the VA is pretty good on transportation. It can be sometimes, as you brought up, emotional or spiritual beliefs. It can be that, well, Saul had a case that he told me about where, the veteran, when he was a kid, had just had this really traumatic experience with doctors. And he never wanted to interact with doctors. And so he said as little as possible all the time, had to be dragged there by his wife, usually. And that was a big stumbling block. Like, it was really important in his healthcare, because of the conditions he had, that he'd be able to interact on a regular basis with a doctor. And that kind of past experience is context about why he was not showing up for appointments or not calling when there was a problem that he really needed to get help with.
Yeah. Well, I feel that's got to be, one of the biggest barriers just with working in the VA in general is, even though they have a lot of resources for, mental health. They have caseworkers and that, like we were saying, right there in the building. They can, send them down a couple of floors and they can, get their needs addressed. But I mean, just that trauma that, that makes a lot of guys, not want to express those feelings because, sometimes they're just that painful.
Yep.
I mean, that issue's got to be so prevalent there. Let me ask you, what were the difference in like questionnaires that you were giving like VA doctors as opposed to, more in or private in practice doctors? Was there kind of a shift more towards emotional needs?
So when we were doing experimental studies, we were using the same, basically the same experiments in the VA and out of the VA.
Okay.
That's one of the questions in that study, which was originally funded by the VA, was whether the VA doctors performed any worse than the doctors on the outside. By the way, they don't. The VA doctors are great. So we've done the same things in both groups, and then when we look at just kind of the VA patients, as we do now as an ongoing quality improvement program, we don't have a comparison to non-VA for those folks. So, we're feeding back, like I said, stuff about access, stuff about emotion and spiritual and competing responsibilities and so on. But, we don't have the same scale of work in private practice with real patients.